Hi there, my name's Kevin Deans and I'm one of the consultants from the Clinical Biochemistry Department in Aberdeen Royal Infirmary. When someone gets infected with coronavirus, the body produces an immune response, and we can detect that by measuring the body's production of antibodies in blood samples. So come with me, we're going to head into the Clinical Biochemistry lab. We're going to have a chat with a few members of staff who are involved in analysing samples in the lab where we can measure coronavirus antibodies. Biomedical scientist in the Clinical Biochemistry Department here in Aberdeen Royal Infirmary. Mark, there's a lot of machines behind you there. What are they doing?
So Kevin, basically we have all these instruments that are picking up samples that have been taken from GP surgeries and throughout the hospital, and currently we're just working through the backlog. So you can see that each sample is getting to the back of an analyzer, and each of these modules will actually pick up a sample and process it for a result, which then will go through to you, who will be able to feed back to the clinician.
So this is obviously highly automated stuff. So you can see behind us there the tracking system. That basically takes samples to whatever analyzer, and it then knows what tests to do.
Exactly, so basically it'll send a signal over with a test list, and the sample will then basically follow a route to make sure it picks up all those tests and the rest, if it works.
And one of the things that's going to be coming online here in a little while is coronavirus antibody testing. In fact, I've already kind of got it up and running pretty much, basically. Yes. So how does coronavirus antibody testing work?
So with antibody testing, we utilise a method where the sample is mixed with an antibody, and from a reaction that is produced in there, a light is produced, and we're able to read the intensity of the light to gain a reading on how much of the antibody is in the patient's sample.
So how long does it take from a sample coming in the lab here to actually having a result for an antibody level?
It depends on the priority of the sample, but obviously we have different turnaround times, whether it be 24 hours for a GP sample or 48 hours, and whether it be an hour plus for an A&E sample. But so I would say on average we're getting a result for a patient sample between 30 minutes to an hour and a half.
So this is pretty quick sort of
fast turnaround
sort of stuff, really. So as a biomedical scientist, obviously there's a big team of people working that you can see behind us there. We're going to chat to various members of the team. But what is your role in analysis generally of blood samples when you come into the lab? What do you do?
So basically you get different tiers of biomedical science. Scientists within the department, so you get your trainees and then you get your band 6s. I am a band 6, classified as a specialist, so I'm able to do a lot of lone working and to a degree lead in different sections. So when it comes to my duties within the department, I would be doing a lot of maintenance on the analyzers to make sure that we're constantly giving out valid and proper results. I do a lot of preventative maintenance, and I do a lot of troubleshooting of any issues that arise on the track, whether it be different components of the track or it comes to different results that we're getting, that we're checking to make sure they're valid.
And is there a lot of out of hours work? Do you have to do a lot of sort of nights and weekends and that sort of thing?
Since we're a 24-hour department, yes, so we're run 24 hours a day, 7 days a week, so we have different rotas to be on, such as an early shift, which is 7 to about 2:30. We have a normal shift, 9 to 5. We have a back shift, which is 2 to 10 p.m. And then we have a night shift, which goes from 10 p.m. to 7 the next morning. So you can see that we're constantly having a workflow throughout the day.
And if we take us back a bit, here you are, as I said, as a specialist biomedical scientist. That was quite a career path to get there. Can you take us back let's go back to the days when you were at school, which I'm sure isn't that long ago, and tell us how your pathway took you from being at school to being sitting here as a specialist BMS.
Well, basically I studied human biology and chemistry, and once I got decent enough grades with them, I was able to go off to uni at Robert Gordon's University and study an applied course in biomedical science. And basically that means that whilst I'm also studying, there are placement opportunities within the NHS, which kind of gives you a good grasp of the different departments that you could work in. And once I'd worked my way through university and finished my honours project, I managed to get a job as an evening support worker within the NHS, which helped me get into the department. This allowed me to apply for internal applications for a trainee biomedical science post, which then developed as my career grew. And now I'm obviously at a stage where I'm able to do a lot of independent working, and I'm looking at going into more management roles, such as senior positions, etc., and progressing in that way. But the degree has also given me many opportunities. I mean, I could go and join many of the armed forces because they utilise biomedical scientists. I could work in the research field or in private. So it's a very good career path to follow.
So what would you say to a pupil who's in secondary school at the moment and is thinking, well, this looks like quite an interesting career path to follow to become a biomedical scientist? What advice would you give them about how they should pursue that potential career?
Well, the first thing I would say is for the pupil to, contact the NHS, contact maybe some of the lab managers, because you'll be able to get a tour and discuss the prospects of the career that way, and it gives you a good overview of what would all be happening within a laboratory department, because a lot of people just don't know because it's all behind the scenes. So I would say you could do that, and then make sure to focus on your science subjects at university, at high school, and just make sure that you understand that the NHS isn't just a career. It's almost it's a livelihood as well. There's a lot to it, and you'll find that you'll be spending a lot of your time here, so make sure that you love it.
Wise words indeed. Well, thanks very much, Mark, for sharing that with us. We'll let you get back to those samples now. So, this is Angie Robertson, who is a biomedical support worker in clinical biochemistry here in Aberdeen Royal Infirmary. Angie, what do you do in your job?
We actually book in all the bloods that come in from the ERI all around the hospital, and all the GPs out with Aberdeen as well. We've got about 3,000 a day that can come in that we can book in. So they come into the lab and they've got information label on it with a barcode. So we get the barcode, scan the label, and everything's on that patient name, the tests that they're needing, and we check everything is correct on the label on the screen, and then put it into our go into the analyzer.
And the job flow obviously have changed quite a bit. I suppose life for everyone has changed during the coronavirus pandemic. But how has the coronavirus pandemic changed the way you work?
We've all got to wear masks and social distance as much as we can. It's just a totally different way of life, because I've been here 31 years, so it's a totally different way of life that I've been used to. We also just make sure that everything's clean. We clean all out the stations that we're working at, and anything we're using, we're cleaning them more often. No, it's a big change.
Total change for everyone, I guess. What would you say is the best part of your job? What do you enjoy most?
Working with my colleagues. I really enjoy working with my colleagues. I enjoy my job's changed over the years, so it's all the different changes that I see, because it's something new I'm learning every time. And it just makes you feel good that you're actually helping a patient. You're dealing with someone, helping someone who's ill in hospital or a GP. I just like the job. I just love it. Sorry.
Fantastic. Well, we love having you working here, and I realise it's been that many years. Oh, there we go. Well, thank you very much, Angie. That's been great to chat to you.
Thank you.
This is Dr. Emma Dewar, who is Principal Clinical Scientist in the Clinical Biochemistry Department at Aberdeen Royal Infirmary. Emma, can you tell us what we're measuring when we do these coronavirus antibody tests?
So we're looking at blood samples from patients. We're looking to see whether they've been exposed to COVID-19. If they have been exposed to COVID-19, they will normally generate an antibody response. We are measuring the antibodies that are present in the sample to say if the sample is positive or negative.
And what does that then tell us? How can we make use of that information?
Making use of that information, we are using it for research purposes at the moment to tell us how many people in the general population have been potentially exposed to COVID-19. It can tell us how many people have previously been infected rather than the number that are currently infected.
So your role as a clinical scientist within all this, we've already spoken to various staff members who work in the lab here. What does a clinical scientist do?
A clinical scientist is responsible for the interpretation and authorization of different results. We assist clinicians, so doctors and nurses, in the ordering and interpretation of different lab requests, in my case for biochemistry. And we also look at a lot of data and interpret that data to ensure that our machines and equipment are running the way that they should be and putting out reliable results.
And how did you get from, if we think back to your school days, how did you get from being at school to being where you are just now? What's your career path been like?
A lot of hard work. I went to school and got good grades in all of my science subjects. I then went to university and did a biomedical science degree, but one that was slightly different from the one that the biomedical scientists do. It's not accredited, so I didn't get any placements in an NHS lab. I got that undergraduate degree. I then went on to do a PhD, looking at breast cancer biomarkers, and then I got hired to do a 3-year national training program to become a clinical scientist specialising in biochemistry.
And what advice would you give to a school pupil who is thinking that this sounds like an interesting career that they'd like to find out more about and potentially pursue? What should they do?
There's a lot of information available on the National School for Healthcare Science website and the NHS Education for Scotland website about clinical scientists, but you can also try and track down one in your local area to come in and have a chat with and get a tour of the lab. Focus in on your science subjects. To train to be a clinical scientist, usually the minimum entry requirement is a good undergraduate degree in a relevant subject, relevant to the one that you want to pursue a career in. But usually they might require more than that.
And how long has it taken you roughly from leaving school to becoming, well, let's go back a few years, let's go to when you were a state registered clinical scientist. How long did that take you?
It took about, honestly, it took about 10 years.
Okay, so quite a long career pathway. What's the best part of your job?
Getting to help patients. I've always wanted to do that, which is why I knew that I didn't just want to be a scientist, I wanted to be a scientist in the NHS, helping people. My job is really interesting and no 2 days are ever the same.
Fantastic. Thanks very much, Emma.
There's been a lot of talk recently in the news about COVID antibody testing, and I'm going to explain a little bit about what that actually means and a bit of an overall introduction to how the immune system works when it's presented with an infection. So we can see on the left hand side there something called IgM. So when the body is first presented with an infection such as a virus or bacteria, in this case the virus could be COVID-19, the first thing that the body does is an IgM protein, it's an antibody, will detect the virus and bind to it, it sticks to it, so that it can alert the rest of the immune system to the fact that there's something there that shouldn't be. We can see that based on its shape, it has lots of little projections, which makes it very good for grabbing all the virus particles in a non-specific way. So it doesn't really know what it's looking at, it just knows that it shouldn't be there. However, after the first exposure, in its place it leaves another type of antibody called IgG, which is the one on the right. This one is specific to whichever virus or bacteria infection has occurred and knows what it's looking for. So the next time that you see a virus or a bacteria, it will attack it more quickly and alert the immune system to its presence more quickly, so you will hopefully get better more quickly. So what we can see here in the graph is roughly what I was talking about there. You can see with the first exposure to a virus or a bacteria, there's a bit of a slow start, and then IgM will detect the virus or the bacteria and rapidly duplicate itself to help alert, to capture most of the virus or the bacteria, and then alert the rest of the immune system. And we can see that afterwards there is IgG left, antibodies left at the end there as well. And what we can see is that afterwards, as I said, these IgG will remember what they've seen before and then are specific and know what to look for if they ever are presented with it again. So if you're reinfected, what would normally happen is you still get a bit of a slow IgM response there, but you get a much faster and more an increased IgG response there to tackle the infection. So hopefully with most diseases you would see a more rapid response the second time that you've seen it, and this is essentially how a lot of vaccinations work as well. In the labs at Aberdeen Royal Infirmary, what we can do, one of the tests that we are doing is for antibody testing. So this is looking to see whether someone has had the disease, not whether they currently have it. So in terms of COVID-19, a sample can be taken from a patient and then it's processed in lab. What we have here are examples of positive antibody tests and negative antibody tests. So what we do is we take the sample and we use our own antibodies that are specific for looking for COVID-19 antibodies. If the COVID-19 antibodies are there, our antibodies will stick to them, and when they do that, they generate a light, and we can detect this light source, and the intensity of that light will tell us if the person is positive for COVID-19 antibodies or not. We can see on the right hand side the negative example of an antibody test, where there's no COVID-19 antibodies in the sample, so our antibodies have nothing to bind to and the lights don't glow. As I said, it's really important to note that this will tell you if someone has had COVID-19 but not if they currently have it. And at the moment in Scotland, what we are using this test for at the moment is research purposes to assess how much of the general population has already been exposed to COVID-19.
So Josh, you're a specialty registrar in chemical pathology. What does a chemical pathologist do?
So a chemical pathologist really works at the interface between laboratory medicine and clinical practice. Our role as doctors in the laboratory is really to help bridge that gap. So because we have expertise in the way that the laboratory works, we're able to bring that knowledge and understanding and hopefully help the clinicians who are on the ward in primary care make better use of the tests they have available and help them answer the clinical questions that they have.
And thinking back a little bit, think back to your school days. How did you get from then to where you are today? What's the career pathway like?
Well, I mean, I think obviously you need to have an interest and an aptitude for science. I think that obviously helps quite a lot. I always liked science in school. That led to a career in medicine. And then after my foundation years, I always knew that I wanted to go into something like laboratory medicine. I like the diagnostic challenges that that offers, and undertook my foundation down south, applied for specialty training up in Aberdeen, and here I am now.
And what would you say is the most enjoyable part of your job as a specialty registrar in chemical pathology?
I think in common with lots of pathologists, the singular joy is being able to see a patient in clinic, albeit virtually nowadays, speak to them, find out what's going on, take a sample, in our case it's usually blood, take it back to the lab, be involved in the analysis, and then be able to communicate that results back to the patient directly and come up with a treatment plan and management. Being able to see that process from end to end is a real singular joy of chemical pathology, and indeed many of the pathology specialties.
And what advice would you give to somebody who's watching, who is still at school, considering career options, thinking that this stuff that you do sounds really interesting? What advice would you give them if they want to pursue a career in chemical pathology?
So I would say that it's really important at this stage to get a good overall grounding in not just chemistry but biology and physics, because these are things that are pretty important in the day-to-day job of being a chemical pathologist. Gain some work experience, doesn't have to be in chemical pathology. Any medical care experience is really useful. And get in touch with your local lab, see what opportunities they have, see what can be done to get them some more experience before they put in an application.
Thanks very much, Josh.
And a very warm welcome to our new laboratory here at Aberdeen Royal Infirmary. "29 weeks ago, we answered a call from Public Health Scotland to help with a national population-based seroprevalence surveillance study for COVID-19. Despite an ongoing 5-month laboratory refurbishment, we were acutely aware of the importance of participating in this study to carefully track the spread of the pandemic. And we really wanted to do our bit. So, despite being in the middle of a building site, we designed, from scratch, a local protocol to provide the residual sera necessary for antibody testing. The success of this project has been down to my incredibly dedicated colleagues, doctors, clinical and biomedical scientists, and biomedical support staff have all pulled together to ensure that high-quality data and blood specimens were available. Our team, which works at a frontier where laboratory science meets patient care, has been crucial in maintaining a safe and effective service, and the team has excelled. Despite the enormous challenges of getting the new laboratory up and running and additional workload pressures from COVID-19. As a result, to date, we have made 1,505 specimens from 1,486 unique patients available over a 29-week period. The results have gone on to inform public health policy, and our input to this study has been picked up by local and national news. We've also received extremely positive feedback from Public Health Scotland, and our laboratory was recently recognised with a special NHS Grampian Orange Award for our outstanding service. The study has now been funded through 2021, and clearly having a robust local collection protocol has been absolutely essential in ensuring consistently reliable results. Using our expertise with this study, we will be implementing our approach again with other upcoming COVID-19 related studies where residual blood specimen collections are again required. We're really looking forward to having an opportunity to continue to play a key role in pathology's response to COVID-19.
Ewan, tell us how you got to be in this role.
Well, it's kind of a long story. the short story of it was I did a PhD in near-death experiences. People coming at their body in operating theatres, having visions of the procedure, seeing tunnels of light, meeting Jesus, going back down, coming back into the body again. And I did a lot of research through that palliative care, and I realised in research on palliative care I was more interested in the medicine than I was in the near-death experience part. So that led me into medicine. I did my degree in medicine, I did my foundation years as a junior doctor. I did a couple of years of psychiatry. Again, I was still missing medicine too much. And one of the great things about chemical pathology, and as you know, we worked together when I was a junior doctor, was that it's basically internal medicine without a board. So I get to do all kinds of really interesting facets of medicine. I get to do lipid clinic, I get to do metabolic clinic, I get to do DPN, nutrition via the veins. I get to do a bit of lab experience as well, lab work with a lot of great scientists in that particular domain. And yeah, it's just a really nice blend of the science and the medicine.
Okay, here's a challenge for you.
Okay.
I'm going to give you 30 seconds. You've got 30 seconds to sell to anybody who's considering career options, maybe school pupils or whatever. Sell lab medicine as a career.
Okay.
Go.
Well, it's very diverse. kind of things you can specialise in and do in the kind of hybrid field that we're in is colossal. It's diverse. As I've said already, the experience you have in terms of the clinical pathology is very interesting. It's very much kind of medical based. You've got cardiology, diabetes, endocrine, inborn errors and metabolism. At the same time, you get to do lab-based stuff, so you get to just learn a little bit of the nuts and bolts of how you make diagnoses. And that's really, you're at the nub of it with the kind of diagnostic centre that you're in. You're in part responsible for finding the results from your antibody. So overall, I think it's a really great hybrid specialty to work with.
Okay, sold. Thank you very much. So you've seen a bit about what's involved in coronavirus antibody testing. Hopefully you've seen that lots of different staff groups are involved and all play a role in that pathway from the sample arriving in the lab through to the results leaving the lab and us making sense of what the results mean. And hopefully you've seen a bit about the useful information that coronavirus antibody testing gives us as we try to get a measure of just how common coronavirus infection is.